All right, so good evening again, everybody. Excuse me. Thank you for joining us tonight. We're going to get started. We still got some people coming in, but we'll go ahead and get started anyways. Hopefully everybody can hear me all right. If you do have a problem hearing me, please let me know. I also sent an email last night to everybody that included the handouts for tonight's presentation, along with a copy of all the slides for the presentation. For your convenience, if you did not get that, please feel free to let me know by typing in the chat box, and I'll make sure that I send that out to you again. But otherwise, I think we will go ahead and get started. All right. So again, welcome. You have decided to join us, and we appreciate it, for Medicare 101. This is part 2 of a 4-part series. Tonight, we're going to talk about Medigap, otherwise known as Medicare Supplements, and Medicare Advantage plans. To start with, I am with the Pikes Peak Area Agency on Aging. The mission of the Area Agency on Aging is to provide services and programs that help people stay in their homes for as long as possible by removing barriers to independent living. We coordinate with other communities in El Paso, Park, and Teller counties to provide advocacy and leadership for those needs. I specifically, through the Pikes Peak Area Agency on Aging, am with the SHIP program, Senior Insurance Assistance, and the SHIP program is a federally funded program that's specifically designed to provide unbiased, in-depth information and education on all things Medicare. And we service, through the Area Agency on Aging, a total of 9 counties in Colorado for SHIP services. We're going to do a real quick review of our information that we talked about last week. We talked about Medicare Part A and Medicare Part B. Medicare Part A for most people is at no cost, covers your inpatient hospitalizations, skilled nursing facilities, and medically necessary home health care and hospice services. And some deductibles and co-insurances costs can apply for Part A services. We also covered Medicare Part B, and we learned that everybody typically has to pay a premium for Medicare Part B, and it covers all your outpatient services. It also has an annual deductible, and co-insurances do apply to those services. Just a sec. Damn it. Sorry about that. My neighbor's dogs are kind of annoying. All right. So now that you have Medicare, we're going to talk about the options that are available to you to go with Medicare. When we talk about Medicare A and B, Medicare A and B benefits are referred to generally as your original Medicare benefits. So we're going to talk about the insurance options that are specifically designed to go with those benefits. So these are the options available to anybody who decides to enroll in original Medicare. We're going to talk about Medicare Supplements, also known as Medigap. Medicare Supplement and Medigap are 2 terms for the same thing. And we're going to talk about Medicare Advantage plans, also sometimes referred to as Medicare Part C. Both of these options are available to anybody who has enrolled in original Medicare benefits. Both kinds of coverages are regulated by Medicare, and typically there are limited enrollment periods when you can get into these kinds of benefits. We're going to talk about Medicare Supplements first. Again, also known as Medigap, those 2 terms are interchangeable. Medicare Supplement and Medigap are 2 terms for the exact same coverage. So what is Medigap? Typically, Medigap health insurance policies are private policies sold by private insurance companies that are solely and specifically designed to supplement the costs that Medicare A and B might leave over. They are required to follow all federal and state laws that are designed to protect you. A Medicare supplement policy or a Medigap policy, when you purchase it, must say Medicare supplement insurance on it. And the term Medigap typically comes from the thought process that it covers the gaps in your original Medicare benefits. There are several different levels of coverage to choose from with a Medigap. They're labeled A through N, kind of like the alphabet, with a few states that have some additional options aside from the standardized levels of coverage that we'll talk about. And we're going to learn that cost varies for Medicare supplements by plan, by company, and by where you live, your zip code. Medicare supplements or Medigaps only work with original Medicare A and B. So you have to be enrolled in both Medicare A and B to enroll in a Medicare supplement. There are some situations where you do not need a Medicare supplement or may not need a Medicare supplement. If you are already enrolled in a Medicare Advantage plan, you cannot enroll in a Medicare supplement. You cannot do both supplements and Advantage plans at the same time. It's a one or the other kind of situation. There are other Medicare plans that you may be enrolled in or could enroll in where you would not need or be allowed to enroll in a Medicare supplement. Or if you have the option or availability of other credible coverage. For example, if you are retired military and will have access to TRICARE for life, you will not need a supplement. You will not need anything besides TRICARE for life. Or if you are a para-retiree or a federal civil service retiree, or even a private employer retiree that offers their retirees healthcare benefits that are designed to coordinate with Medicare, you may not need a Medicare supplement. Because Medicare supplements are designed only to work with original Medicare, and original Medicare is good with any provider in any state for any medically necessary service, as long as that provider accepts Medicare as a health benefit, you can go anywhere in the country for services. You do not have to ask anybody's permission. No referrals, no prior authorizations are required. And particularly for those who snowbird or tend to travel a lot, it is the most portable option to use because there also are no networks to worry about. So again, anybody with original A and B of Medicare has the option or opportunity to purchase a Medigap policy or Medicare supplement. There are certain timeframes that are better to purchase them than others. For example, when you first become enrolled in Medicare A and B, you will be provided with what's called the guarantee issue period. But you can enroll in a Medicare supplement at any time. There is no actual enrollment period for Medicare supplements. You can enroll in a Medicare supplement at any time of the year for any reason whatsoever, as long as you can pass underwriting. And what that means is, as long as you are healthy enough for the insurance company to want to sell you insurance outside of a guarantee issue period, which we'll talk about a little bit more in a minute, companies are happy to enroll you at any time of the year. So there is no, again, annual or open enrollment period for Medicare supplements. In the state of Colorado specifically, and in other states as well, Medicare supplements are guaranteed for people who are under 65 on Medicare. So if you have become eligible for Medicare due to being on Social Security disability, typically that means you are under 65 becoming eligible for Medicare. And typically that's going to mean that you may have some pre-existing health issues. In the state of Colorado, we do provide a guarantee issue period for people under 65 that allows you to purchase a Medicare supplement without underwriting, as long as you do it within the guarantee issue period. However, you need to be aware that Medicare supplement premiums will be more expensive due to the fact that someone is under 65. However, on the plus side, for those people who are on Medicare under 65, whether you can afford the supplement premiums under 65 or not, when you turn 65, you will have another opportunity to be guaranteed issue into a Medicare supplement without underwriting, and the price does go down to purchase that kind of coverage. So again, there are times that are better to try and purchase a Medicare supplement than others. And that specifically is going to be the guarantee issue period, also known as the supplement open enrollment period. This guarantee issue period lasts for a total of 6 months, and that clock starts ticking from the day your Medicare A and B benefits go into effect. Because again, you have to have both A and B of Medicare in order to enroll in a Medicare supplement. Once that clock starts ticking, once that 6-month clock starts ticking, it cannot be stopped. So what that means is a guarantee issue period means that you can enroll in a Medicare supplement policy, any level of coverage with any company of your choice. And if you do it during that 6-month window of guarantee issue, you cannot be underwritten, meaning they cannot look at your health history and they cannot turn you down for coverage for any reason whatsoever. Once that guarantee issue period of 6 months expires, it's gone. And if you try to purchase a Medicare supplement after that 6-month period expires, or if you try and switch to a different Medicare supplement after that 6-month period expires, you are very likely going to be subject to underwriting, even if it's within the same company. And they can turn you down if they do not like what they find in your health history. Underwriting does not mean that you will have to take a physical, because you won't, but they will look at your medical history. And if they don't like what they see, they do not have to sell you insurance. Now, some of you are probably thinking about the Affordable Care Act, where that has guaranteed people not to be denied coverage by insurance. And unfortunately, that does not apply to Medicare and Medicare products. So Medicare supplements are allowed to underwrite, but because Medicare supplements have always provided a window where you can purchase coverage from them without underwriting, excuse me, well before the Affordable Care Act came around, that is one of the reasons the Affordable Care Act rules are not applicable to Medicare supplements, because they have always provided an opportunity to purchase coverage without underwriting. Now, there may be other situations, excuse me, there may be other situations where you would have an opportunity to enroll in a supplement without underwriting, and we will talk about those as we go here. Primarily, anytime you have another opportunity to enroll in a Medicare supplement without underwriting, it's going to be considered a special enrollment period. Medicare does provide a number of different scenarios where you could get a special enrollment period where you can purchase a supplement without any underwriting. Primarily, any special enrollment period will have to involve some sort of involuntary loss of other coverage, though. So when I say involuntary loss, meaning you lost coverage not through your own fault. For example, if you have employer group coverage and that employment ends, so that group coverage ends, that is not considered your fault because the coverage ended through no fault of your own. So employer coverage ending, employer coverage is also considered credible coverage. So whether it's involuntary loss of coverage or just the loss of any credible coverage, that does provide you a window of guarantee issue into a Medicare supplement. However, if that loss of credible coverage or involuntary loss of other coverage happens after you turn 65, then the window of opportunity for you to have guarantee issue into a supplement based on those situations can be much shorter. than 6 months. Another way you can get a special enrollment period where you have guarantee issue into a Medicare supplement is through an Advantage plan and what they call the test drive or trial right with Advantage plans, which we will discuss in detail in the next, when we get to the Medicare Advantage plan topic. There are some things that Medicare supplement insurance does not cover, and those are going to be the same services that Medicare A and B do not cover. The whole point of a Medicare supplement is that it will supplement the costs that Medicare left over after they paid their part first. So if it's not a benefit of Medicare, it is not going to be a benefit of the supplement. If it's a service of or a benefit of Medicare, but Medicare denies coverage for that service or benefit, then the supplement will also deny coverage of that service or benefit. So Medicare supplements will only pay the balance after Medicare as long as Medicare paid their part first, period. So things that are not covered by Medicare supplements are going to include long-term care benefits, dental and vision services, hearing aids, private duty nursing, outpatient prescription drugs. Of course, outpatient prescription drugs are now covered under Medicare Part D, which is going to be next week's topic. But again, if Medicare denies paying for a service, or it's not a service or benefit of original A and B Medicare, it is not going to be covered by the supplement either. So keep that in mind. In the email that I sent everyone, which hopefully you all got, I sent it last night, it included the handouts for today's presentation. And in that set of handouts, there was a couple of documents that pertain specifically to Medicare supplements. The first document is a chart, and this chart outlines the different levels of coverage you have to choose from regarding Medicare supplement coverage. Again, the plan levels are labeled A through N, kind of like the alphabet with some of the letters missing. And each plan letter, if you look at this chart, the benefits described under each plan letter designation is the benefit that it pays after Medicare. For example, if you look at Medicare Supplement Plan A, not Medicare Part A, but Supplement Plan A to go with your Part A and B of Medicare, it covers what's called basic benefits. Basic benefits are basically going to be the 20% for Medicare that Medicare left over for Part B services, your outpatient coverage. So if you have Medicare Part B typically pays services at an 80-20 split. A supplement under Plan A will pay that 20%, so that your Part B services would be covered between Medicare and the supplement at 100%. But that's all Plan A covers, is that 20% for your Part B services. Plan B supplement includes that 20% for Part B services, and it also includes your inpatient hospitalization deductible every time you're admitted to the hospital. Again, that inpatient hospital deductible for this year is $1,482 per admission. Supplement Plan B would pay that deductible every time you're admitted to the hospital. Plan C and Plan F are two plan options that are no longer available for anybody who becomes eligible for Medicare after 2020. So if you're eligible for Medicare anytime starting January 1st of 2020, Plan C and Plan F are not available to you. If you were eligible for Medicare anytime prior to January 1st of 2020, so say you turned 65 2 years ago, but you continue to work and have employer coverage, now you're retiring and losing that employer coverage, and you're looking at your options, you would still have the option of enrolling in a Plan C or Plan F supplement because your eligibility for Medicare started before January 1st of 2020. But anybody whose eligibility for Medicare A and B didn't come into effect until after January 1st of 2020, your next best option is going to be Plan D. Plan D supplement Again, covers basic benefits, the 20% for your Part B services, the 20% co-insurance. It also covers the skilled nursing facility co-insurance. So if you remember from last week, Medicare Part A covers inpatient skilled care after a 3-day or longer hospital stay. That skilled care benefit, Medicare pays at 100% for the first 20 days. And then starting at day 21 of that skilled facility stay, Medicare will continue to pay everything except a daily co-insurance. This year, that daily co-insurance amount is $185.50 per day. If you have a plan D or higher, it will pay that $185.50 per day up to day 100. And Plan D also covers the Part A inpatient hospital deductible every time you're admitted. And if you look at the very bottom of that column, you'll see that it also covers some foreign travel emergency benefits. Now, for the plans that do cover foreign travel emergency, we learned last week that Medicare does not provide coverage to anybody outside of the United States and/or territories. And a supplement will provide some coverage, but it's not an insurance benefit. What the foreign travel emergency coverage is through a Medicare supplement is a reimbursement benefit. So if you are in a foreign country and you have a medical emergency, you pay for that emergency while you're in the foreign country. You pay the bill there. But when you get home, you can submit that bill to the supplement. The supplement, of course, is going to turn around and tell you to submit it to Medicare for a Medicare denial so that they can see that Medicare is not going to pay that benefit. Once you have a Medicare denial, you resubmit it to your supplement and they will reimburse you 80% of the cost of that medical emergency after a $250 deductible. So again, it's not a medical benefit at the time of travel, but it can be some reimbursement when you get home for the cost of that medical emergency while you're out of the country. You do have to be patient to get that benefit reimbursed, and you do have to be a little tenacious about getting it. But it is up to 80% reimbursement for the cost of any medical emergency out of this country. So any of the supplement plans that include that foreign travel emergency clause, that is how that's going to work. The next best plan, and the plan I'm sure people have heard about, or if you've talked to any sort of agent or broker, they've probably talked about it with you. Plan G, as in goat, is currently going to be considered basically the Cadillac of Medicare supplement options. Plan G covers your 20% for Part B services, covers the skilled nursing co-insurance starting day 21, covers your inpatient hospitalization at 100% deductible every time you're admitted, covers the foreign travel emergency. It also covers additional benefits called Part B excess. Part B excess refers to the difference between Medicare providers that take Medicare assignment and providers that do not take Medicare assignment. What that means is there are two different ways providers can get paid by Medicare. So any medical provider who is willing to take Medicare as a coverage, and you as a Medicare patient, is by law required to bill Medicare. So the way Medicare billing works, say for a standard office visit, say you go for a standard office visit with your primary doctor, and that doctor would normally charge $300 in cash if you didn't have insurance. So he values your office visit at a $300 retail price, but you have Medicare. So that doctor is going to bill Medicare because he's required by law to bill Medicare for you. That doctor is going to bill Medicare $300. Medicare turns around and they assign what they believe that office visit is worth. So the doctor is going to bill Medicare $300. Medicare is going to turn around and say that this visit is worth $100, and they're going to pay 80% of that assigned amount. So Medicare pays 80% of $100. Your supplement under basic benefits would pay the other 20% of the $100. When a doctor accepts Medicare assignment, that doctor accepts that $100 total as payment in full. In that situation, the doctor is going to bill Medicare for you because by law he is required to. Medicare is going to pay that doctor directly, and your supplement is going to pay that doctor directly. You should not have to pay anything at the time of service. Then there's doctors who do not take assignment. Basically works the same way. You go for an office visit, that doctor is going to bill Medicare $300. Potentially, Medicare is going to turn around and say that visit is worth $100 and pay 80%. The supplement will pay the other 20%. But doctors who do not take Medicare assignment are going to do two things. First of all, they're going to be allowed to charge you 15% more than what Medicare assigned for their services. Because Medicare has already got a predetermined dollar amount for any and every service you could ever receive, that doctor knows how much Medicare is going to allow or assign for that service, for that office visit. So that doctor knows that he's only going to be allowed or approved for $100. He is going to be allowed to charge you $115, 15% above and beyond what Medicare allows. And he's probably going to ask you to pay $115 up front at the time of visit. Again, he still has to bill Medicare by law. He's required to. But when Medicare gets that doctor's claim, Medicare is going to see that that doctor does not take assignment, and Medicare is going to assume that you've already paid him $115. So when Medicare gets the claim, they're going to process that claim, and then they're going to cut you a check for $80 and send it directly to you. Balance gets sent to the supplement. The supplement is also going to cut you a check and send you the balance of 20% or $20. If you have Plan G that includes Part B excess benefits, not only will the supplement pay you the 20% or $20 that Medicare left over, it will also pay you that extra 15% that you paid that doctor upfront. So the Part B excess benefit is actually that extra 15% that doctors who do not take Medicare assignment will charge you upfront. Fortunately, most doctors in this El Paso County specifically take assignment. There are very few Medicare doctors that do not take assignment in our area, but they may be more common in other areas. So if you travel, it might be something that you run into more often. Worst case scenario, if you get a plan that does not include that benefit, you will still get reimbursed the Medicare allowed amount, but you would not get reimbursed that extra 15% that that provider may have charged you upfront. Are there any questions about how that works? Any questions about any of that? If people have questions, you can either type it in the chat box, or when I do pause for questions, simply unmute yourself. So any questions about any of this so far? All right. Then we will move on. So again, Plan G is currently considered basically the Cadillac of Medicare supplements. And it is the plan that that is very, very popular. It's very, very reasonably priced plan. It's going to be a plan that you hear about. The next three plans, plans K, L, and M, are going to provide the first three benefits, basic benefits, the other 20%, skilled care, co-insurance, and the hospital deductible. The difference is that Plan K only pays those benefits at 50% of the 20% for basic benefits. It pays 50% of the daily co-insurance for skilled care. It only pays 50% of your inpatient hospitalization deductible. Plan L pays those same benefits at 75%. Because both of those plans pay less than 100% of the balance that Medicare left over, those plans are less costly in premium. Those plans also have a max out of pocket. So if for some reason your balance, the amount that you had to pay after Medicare and your supplement paid their part, reach that max out of pocket. In the case of Plan K, that max out of pocket is $6,200 and change. In the Plan L, it is $3,100 and change. If you were to spend out of your pocket that amount, once you hit that limit, then the plan would have to pay 100% after Medicare for the rest of the calendar year. But when the new year started, that out-of-pocket max would reset. So keep that in mind. Plan M is kind of a hybrid. It does pay 100% of the basic benefits. It pays 100% for skilled care coinsurance, but it only pays half of the hospital deductible. On the other hand, it does include the foreign travel emergency clause. And then Plan N, the very last plan option, which honestly has become pretty popular. It pays 100% for basic benefits, except for office visits of any kind or ER visits of any kind. For those two services, it applies a $20 copay for office visits. It applies a $50 copay for emergency room visits, but it does pay all other balances for Part B services at 100%. Pays 100% for skilled care coinsurance, and it pays 100% for your hospital deductible. It includes the foreign travel emergency clause. So again, M and N are kind of hybrids. K and L are kind of hybrids. So these are the levels of coverage you have to choose from as a Medicare supplement. What I tend to encourage people to do when they're looking at purchasing a Medicare supplement before they do anything else is decide what level of coverage is going to work best for them for the long haul. Because basically when you're looking at buying a Medicare supplement, you are looking at potentially having this coverage for a very long time. Again, this is not the kind of coverage that you have an annual opportunity to change. There is no annual open enrollment period. And if you try and change this coverage to go to a different plan or a different company after your 6 months of guarantee issue has expired when you first get Medicare, you are subject to underwriting most of the time, meaning they will look at your health history. And if they don't like what they see, they do not have to either sell you a policy or change your policy. Once you're in, and that company has to continue to insure you at whatever level of benefits you choose for as long as you choose to pay for it. But once you're out, you could potentially be out because of underwriting. Things that you should also understand when it comes to Medicare supplements is they can offer some additional benefits. For example, for those for inpatient hospital stays, these plans not only pay the hospital deductible every time you're admitted, but they also pay the coinsurances for extended hospitalizations. So if you're in the hospital for longer than 60 days, it will pay that $371 daily coinsurance that Medicare applies. If you're there for longer than 90 days, it pays the $742 coinsurance. What it will also pay if you're in the hospital for longer than 150 days is up to 365 additional full coverage, 100% paid hospital days. But again, you'd have to be there for longer than the 150 consecutive days. So, God forbid you find yourself in a coma or something. That's when that benefit would kick in, but it does provide 100% coverage for an additional 365 days in that scenario. It also covers the cost of the first 3 pints of blood that Medicare does not cover. No part of Medicare will cover the first 3 pints of blood somebody might need, but a supplement will. So those are some extra benefits that most people aren't aware of that are included with all Medicare supplement policies, all levels of coverage. The other handout that I included in the email that I sent you is going to be a multi-page handout. This handout is put together by the Division of Insurance. for the state of Colorado. We are very fortunate in Colorado that our Division of Insurance takes the time and energy to put this document together. Because A, it's a very complicated document, but it's a very, it's a lot of work because there are a lot of companies licensed to sell Medicare supplements in the state of Colorado. What this document is going to provide to you is in the first several pages of it, it's going to basically go over everything I just talked about. It's going to go over the guarantee issue period. It's going to tell you about underwriting, those kinds of things, some basic information. But about halfway through that document, you'll come to charts. And these charts are the charts that most people are going to be most interested in. Each page of these charts will have an age group at the top of the page. So if you'll notice that in this example, it says age 65 at the very top in the center. Each page is going to be an age group, 65 to 69. The next page would go to 70 to 74. The page after that is 75 to 79 and so forth. Each page is going to list each company, every company that is licensed to sell a Medicare supplement in the state of Colorado, front to back of each page in alphabetical order. Across the top, you're going to see A through N, just like the chart we just went over. What this is going to tell you is based on the company. If you intersect company X, so let's use Globe Life, for example. If you intersect Globe Life with, for example, Plan G, if there is a number where those two intersect, that number does represent an approximate monthly premium for that plan with that company. Now I'm going to stress that this is an approximate amount of premium. It is not going to be an exact premium quote. And the reason is because premiums, again, vary not only by company, they vary by plan level, but they also vary by where you live, by zip code. The estimates that are gathered specifically for this chart, if you'll look at the very top, were gathered for an 80202 zip code, a Denver zip code. Denver does tend to pay a little bit higher premiums than we would pay in El Paso County or Southern Colorado. So even though these are not going to be exact price quotes, I can say that they're going to be in the ballpark. They may be a little bit high compared to what you might be quoted directly from an insurance company, but they're going to give you an idea of how much each company will charge you for any plan that they sell. Now, if you intersect a company with a plan, say Plan D, you intersect AARP with Plan D column, and there is nothing in that box, that means that company does not sell that plan. And you'll see a lot of empty boxes. Supplement insurers are only required to sell Plan A, to call themselves a Medicare supplement. Every plan after Plan A is optional for them to sell. So they will pick and choose what plans they want to sell. So not every company is going to sell every plan. As a matter of fact, very few companies sell all plans. But again, that's one of the reasons that I encourage you to pick your plan first. Pick the level of coverage that you are comfortable with or that you would feel comfortable with for the long haul before you start shopping around for the best price for that plan. Now, the other thing to understand is that when you're looking at supplement plans, a Plan G is a Plan G is a Plan G, no matter who you buy it from. They are all selling the exact same Plan G. They cannot change these plans in any way whatsoever. They cannot alter them. They cannot add to them. They cannot subtract to them. These plans are set in stone as they're outlined on this chart, period. So it truly is a matter of a Plan G is a Plan G is a Plan G, no matter who you buy it from. So it does pay to shop around. Once you've picked your plan, it does pay to shop around for the best price for that plan. And again, this chart is going to help you kind of weed out the companies that you would potentially want to contact directly to get an exact price quote. The other way you might be able to get an exact price quote, because if you guys are becoming eligible for Medicare, I'm sure you're already being inundated with junk mail. If any of that junk mail is from an insurance supplement carrier, it may include an application. It may include one of these charts or a chart very similar to this that outlines the different plans. And if you get a mailing that includes an application or even includes a chart that looks similar to this, if it has a price quoted in it, that would be an exact price quoted for you, because you are in what's called the guarantee issue period. You're in a preferred pricing tier within that 6 months of becoming Medicare eligible. So whatever price you get in the junk mail, as long as it includes one of those charts that outlines the different plans, then that probably is an exact price quote. Otherwise, you are likely going to have to call the plans directly or talk to an agent or broker to get an exact price quote for whatever plan you're interested in for your area. So I'm going to jump real quick to a couple of questions that I've gotten in the chat box, and then I will open up the mic to see if anybody has any questions they want to ask verbally. So the first question I have is, what is the average cost of a Plan G? Well, basically, it depends, but about $140 or $150. But if you look at the chart in the handout that I sent you, you may notice that premiums can vary quite significantly between companies. So, premium could be as low as $120 or easily as high as $200 plus, depending on the company. That's another reason it pays to shop around. The next question is, what is the open enrollment at the end of the year for? What is the guarantee issue time frame for retiring over 65 years? So the open enrollment that you hear about, I'm sure more often than you care to, because it's widely advertised. There's lots and lots of commercials and infomercials on TV. That open enrollment pertains to Medicare Advantage plans and Medicare drug plans. And we will be talking about those enrollment periods when we get to the next section of the Medicare Advantage plans. What is the guarantee issue time frame for someone retiring over age 65? If you are losing employer coverage, or you have lost credible coverage or involuntarily lost coverage of some sort, typically your time frame is going to depend on whether or not you've enrolled in Medicare or not. If you're already enrolled in Medicare, your time frame to have guarantee issue based on losing employer coverage, if you're already enrolled in Medicare, is about 63 days. If you have not enrolled in Medicare A and B both before you retire, then you have a 6-month window based on the fact that it starts when you have both A and B of Medicare. So even people who continue to work past age 65 but enrolled in Medicare Part A, you retire, you decide to enroll in Medicare Part B, it's when that Part B benefit kicks in. So now that you have both A and B, that 6-month guarantee issue window starts because you're brand new to Medicare. But if you've already enrolled in Parts A and B before you retire, you only get a 63-day window when you retire. Hopefully that answers your question. Had another question about the handout, which is Colorado specific. And the question is, what if you move out of state? Will the rates be different? What if the provider we choose does not do business out of state? So the way these are supposed to work is they go where you go. So if you buy a supplement policy in the state of Colorado, but you move to another state a year from now, 2 years from now, yes, the premiums can change when you move, but you should be able to take that policy with you no matter where you go. Because Medicare is good everywhere in this country, your supplement is good wherever Medicare goes. You should be able to take that policy with you. It should not be a situation where it stops at the border. as long as it's a standardized A through N plan. So it cannot, you should not run into a situation where the insurance company will not let you go out of state. That should not happen. If you ever find that happening, please report that to the Division of Insurance because they need to know, because it shouldn't happen. So hopefully that answers that question. And the last question in chat, what are the ramifications of a high deductible plan G and the monthly premium? Okay, so let's talk about high deductible. So plan G comes in a standard and it also comes in a high deductible. When you purchase a high deductible supplement plan like plan G, what that means is that plan will pay nothing after Medicare until you have spent, and for 2021, the high deductible limit is $2,370 out of your pocket after Medicare has paid their part. So we're talking about only the amounts of Medicare left over that the supplement would normally pay. You would have to pay $2,370 out of your pocket before that high deductible plan paid anything. So Medicare is always going to pay their part, but a high deductible plan will not pay anything until you spend $2,370, and that amount does change every year until you spend that amount out of your pocket in those balances Medicare left over. Once you spend that amount within the calendar year, then the plan will kick in at 100%. But come the first of the next year, that starts over and you're subject to that deductible again. So it's exactly what it sounds like. It is a deductible that you have to meet before your insurance plan would pay anything. Premiums for that plan are significantly lower because of that benefit, or that lack of benefit, I should say. And what you would have to weigh is basically either how healthy are you, how often do you doctor, and if you had a really, really bad year and were doctoring or hospitalized multiple times, would you be able to afford that deductible? Versus paying a regular premium for a standard plan G that pays all those costs from day one. So hopefully that answers your question. Premiums for high deductible should be reflected in this chart, although it does only show plan F high deductible because plan F also comes in a high deductible option. For some reason, they did not get the high deductible G premiums listed here. So I do apologize, it is not reflected in the chart. If you wanted a quote for a high deductible plan G, you would have to call a company directly. Hopefully that information will be included in next year's chart, but for some reason it was not included. And I think that a lot of that had to do with the fact that when this chart was published, they still weren't sure that plan G would have a high deductible. That had not been confirmed. So I apologize for that, but hopefully that will be updated next year. And then I also had a question on why costs are different for the same plan. So again, it does pay to shop around, but a plan G is a plan G. So every one of these 40 plus companies listed on each one of these pages, front to back, sell the same plan G, the same benefits, the same plan. Prices will vary. Why? Because they can, basically. Each company is going to determine, based on its own convoluted calculations, what it can afford to risk. They have their own calculations for age and area and, you know, all of the things that they can take into consideration. They have to calculate how much that company is worth, how much money they make. I mean, there are so many different things that can go into calculations for monthly premiums with any given company. I don't even want to fathom, I guess, beyond speculation of general guidance. But basically it's because they can. And that's one of the reasons it does pay to shop around. The important thing is that a plan G is a plan G. Once you buy a Plan G, that Plan G will stay the same, cover those benefits as they're outlined today forever, as long as you pay the premium. Companies cannot ever cancel your benefits or your policy for any reason other than non-payment of premium. So as long as you are paying the premium, your coverage will stay the same forever, which is a good thing. But again, if you ever cancel that policy or get out of your supplement, you may be subject to underwriting to try and get into a different policy or get back into a supplement. And then I'll take one more quick question. Within the same company's Plan G, can you switch from a high deductible to a regular plan without a future, I'm assuming it says future health checkup, but I think what you mean is underwriting. The bottom line is no. Companies are allowed to underwrite, and typically they will underwrite. There may be some exceptions to that rule. I know AARP United Healthcare tends to be a little more flexible when it comes to switching plans within their company. And within the first 3 years of turning 65, they're a lot more flexible. But most companies are gonna subject you to underwriting for any change you may want to make, even within the same company. And you can change plans as long as you can pass underwriting. So again, there's no annual enrollment period for Medicare supplements. There's no regular opportunity for you to change to a different plan or a different company. Once you're in, you're in, but once you're out, you could be out. Also keep in mind that premiums for supplements do increase on an annual basis at minimum. Just like any other kind of insurance we may have, whether it's homeowners, car insurance, whatever, premiums increase at least once a year. Why? Because they can justify an increase in premiums to the Division of Insurance, which all premium increases do have to be vetted through the Division of Insurance every year. But if they can justify that their outgoing outpace their incoming, then the Division of Insurance will allow a premium increase. Cost of living, cost of medical expenses has gone up, whatever. So also keep that in mind. The average premium increase across all companies is going to be about 6 to 15%, depending on the company. But on average, it should not usually exceed 15%. Will it exceed 15% at some point? Possibly. Just because the average is 6 to 15% annual increase in premium does not mean that it's not ever going to be more than that. But it could also at sometimes be less than that. It's just, again, like any other insurance, there's going to be a premium change on at least once a year basis. And it's something that you should calculate into your decision making. Do they change just because you reach a different age bracket? Not necessarily. The premiums are usually going to be based on the age that you are when you purchase them. But some companies may base your premiums on age groups. And in this chart on the page prior to the first chart that shows the premiums, there is a key code for all the little keys that are listed right next to the company names that tell you whether or not there's an application fee, whether or not they are age rated or issue age rated or community rated. Those kind of tell you how the companies determine premiums when you first purchase them. Typically, most companies are going to be age or issue rated, meaning they're going to base your premium on the age that you are when you purchase it. And it's not going to go up just because you reach another age group. Hopefully that answered that question. Any other questions before we move on? Again, and I can't stress this enough, I do encourage you to pick your plan first if this is the kind of coverage you choose to go with. Pick your plan first and then shop around for it. You're going to be much happier with a plan that you are comfortable with in a worst case scenario in the long run versus trying to go with a plan because you're healthy, you never go to the doctor now, and you want to go with a plan that's going to give you minimal coverage because of that, that's not why we buy insurance. That's not why we have insurance. We have insurance for those worst case scenarios. So I encourage people to think about a worst case scenario and what you would be most comfortable with in a worst case scenario, and then find something you can afford to accommodate that in the long run. Any other questions? I think I addressed all the questions in chat. If there are other questions that you think of after the presentation, I will provide my contact information at the end so that you can always email me with any additional questions or clarifications. I'm happy to answer those questions at a later time. All right, so if there are no other questions, then we will move on. So basically that is Medicare Supplements. That's how Medicare Supplements work. The next topic we're going to talk about are Medicare Advantage plans, which is your other option to go with original Medicare. Again, we are not talking about any retirement benefit options today. We're not talking about anything other than these two options that are available to anybody and everybody who enroll in original Medicare. But we will be talking about how options work for retirees or in other situations, Medicaid, COBRA, those kinds of things in our last session in 2 weeks. All right, so Medicare Advantage plans. Medicare Advantage plans are the other option that you have to choose from for original Medicare or for anybody who has become enrolled in original Medicare. Medicare Advantage plans are an entirely different animal than Medicare Supplements. They work entirely differently, and they are designed entirely differently than Medicare Supplements. People who enroll in a Medicare Advantage plan, again, these are private, or these are plans that are purchased from private insurance companies, but the difference is that these companies contract directly with Medicare to provide these plans to you. Whereas Medicare Supplement insurance is private insurance that you buy from a private company that coordinates with Medicare, but the companies don't contract directly with Medicare. For Medicare Advantage plans, the insurance companies contract directly with Medicare to provide these plans. When you enroll in a Medicare Advantage plan, you still have original Medicare A and B. You still have to pay your Medicare premium for Part B. But when you enroll in an Advantage plan, that plan takes over your Medicare A and B or replaces it as your primary coverage. Does not mean A and B goes away. It just means that the Advantage plan has now become your A and B. They're doing everything. They're providing all services that original A and B would provide, but now it's through the insurance company. You still will always have all the rights and protections of original Medicare, and you will still have access to all services of original Medicare through the Advantage plans. And Advantage plans may provide some extra benefits. And I'm sure that's a lot of what people are hearing about these days. It's a lot of what all of the infomercials are talking about these days. Basic extras are going to be routine vision and hearing, perhaps some minimal dental care, free gym memberships. Those are the extras that have been included for many years. Just this last year, additional extra benefits have been available through these plans as well. Most Advantage plans will include drug coverage. Your Part D benefit already rolled into that ball of wax. So that plan, that Advantage plan would be your Medicare Part A, your Medicare Part B, and your Medicare Part D all rolled into one plan. So there are limited times and some requirements to enroll in an Advantage plan. Primarily, the biggest requirement is you must live in the plans, the Advantage plan service area. And for all intents and purposes, the plan service area is going to be your county of residence. So you can only enroll in an Advantage plan that's available for purchase in the county that you reside in. Again, you must be enrolled in both Parts A and B of Medicare to enroll in an Advantage plan. And you can only enroll in an Advantage plan during an eligibility period, with a few exceptions for special enrollment. There are multiple enrollment opportunities with Advantage plans, though. So even though you can only enroll during a specific enrollment period, there are multiple periods that might be applicable. The first period is your initial enrollment period. Your initial enrollment period is the time frame that surrounds your enrollment into original Medicare A and B. And it is the same time frame. It includes the 3 months prior to the month of your 65th birthday or the month of eligibility, the month of eligibility or 65th birthday, and up to 3 months beyond the month of eligibility or the month of your 65th birthday. That is your initial enrollment period, that 7-month window. That is the window you have to enroll in A and B. That is also the same time frame that you can enroll in an Advantage plan, keeping in mind that nothing can be effective any sooner than the month of your 65th birthday or month of initial eligibility. Other enrollment periods include the annual election period, or what we tend to refer to simply as open enrollment. That is the fall open enrollment period that runs from October 15th through December 7th every year. There's a new enrollment period specifically for Advantage plans called the annual Medicare Advantage Plan open enrollment period, which runs from January 1st to March 31st each year. And then, of course, there are special enrollment periods. What you'll learn is that Medicare will always provide you an opportunity under a special enrollment period. They'll always provide you an opportunity to enroll in coverage to go with your Medicare. Anytime you have any sort of involuntary loss of other coverage or loss of other credible coverage. Medicare is never going to put you in a situation where you have lost insurance coverage through no fault of your own and you're not able to get other coverage to replace it. And that's usually what a special enrollment period is going to be used for. We're going to talk about all of these in detail. Again, starting with the annual election period, October 15th through December 7th happens every year. During this time frame, you have the ability to do two things. You can get into, get out of, or go from one to another Advantage plan or drug plan. So Medicare Advantage plans that include a Part D benefit or not, and standalone Part D plans that are just drug coverage. This is your annual opportunity to get into, get out of, or switch from one plan to another for either of those options. Any change that you make during this time frame of October 15th through December 7th goes into effect January 1st. If you make a change from one plan to another, that change automatically disenrolls you from the other plan December 31st. The Medicare Advantage open enrollment period, again, this just started a couple of years ago, January of 2019. It runs January 1st through March 31st. During that time frame, if you are already enrolled in a Medicare Advantage plan as of January 1st, so even if you took advantage of the October through December 7th time frame to enroll in a plan that starts January 1st, if that plan starts January 1st, you get this additional 3-month window to decide if you want to change to a different Advantage plan, or if you want to get out of Advantage plans altogether and go back to original Medicare. If you get out of Advantage plans altogether during this 3-month window and go back to original Medicare, you can also enroll in a standalone drug plan so that you're sure to have drug coverage, especially if your Advantage plan included drug coverage. So if you have an Advantage plan that includes drug coverage, you do not need to purchase a separate Part D plan. It's included.
Advantage plans, like she said, are
specific to
county. You don't travel with them.
If you are not currently enrolled in an Advantage plan on January 1st of any given year, this open enrollment period does not apply to you. It only applies to people who are enrolled in an Advantage plan as of January 1st each year. And then special enrollment periods. Special enrollment periods can be applicable with Medicare Advantage plans under multiple situations. The most common situation is going to be if you are enrolled in a Medicare Advantage plan and you move out of the service area. So whether you move from one county to another or from one state to another, because you had to purchase a plan that was available in the county you resided in, when you leave that county, you cannot take that plan with you. Because it's not your fault that you can't take it with you, it is considered involuntary loss of coverage. That involuntary loss of coverage when you make a move provides you two opportunities. You either have an opportunity to be guaranteed issue into a Medicare supplement when you get to the area that you're moving to, or you can enroll in another Advantage plan that might be available in that area. So it gives you two different choices. When you have an Advantage plan and you move out of your county of residence, when you get to where you're going, you either have guarantee issue into a supplement because you lost your coverage, or you can get into another Advantage plan available in the area that you moved to. Again, because you can't take your plan with you when you leave the county, it's considered involuntary loss. And again, anytime you have involuntary loss of a Medicare benefit or related coverage, Medicare will always provide you an opportunity to find something else. The other way, you might get a special enrollment period with an Advantage plan is through what they call the test drive or your trial rate. Medicare Advantage plans are relatively new to the Medicare market. They've been around for a while, but until a couple of years ago, they really had not taken off on the market. There were a handful of companies or plans available, and that was about it. But as of a few years ago, suddenly there are dozens of companies and plans to choose from. Because there are now so many options to choose from and they became available so suddenly, there can be a lot of confusion about Medicare Advantage plans because there can be confusion about how these plans work or what these plans are. Medicare has provided you an opportunity to test drive them, to try them out. What that means is if you decide that you want to try out the Advantage plans, but you're not sure it's going to be the coverage that you want forever, Medicare will give you up to 12 months to try it out. So you can enroll in an Advantage plan for up to 12 months. If at any time during that first 12 months you decide that that coverage is not for you and you want to go get out and go to a supplement, you would be able to at any time without question. If you take advantage of that test drive and you decide to leave the Advantage plan within that 12-month window, you would have guarantee issue into a supplement anytime during that 12 months. If you enroll in an Advantage plan when you first become eligible for Medicare, so you try it out first from the get-go. The test drive of 12 months will coincide with your first 6 months of guarantee issue with a supplement. But it can extend that 6 months of guarantee issue into a supplement for another 6 months under the test drive. The only thing you'd have to be aware of is that if you decide to get out of the Advantage plan in the second half of the year, the second half of that 12-month window, your guarantee issue is limited to a 63-day window. So the first 6 months, you have guarantee issue into a supplement anytime during that 6 months. But under the test drive, if you decide to get out of the Advantage plans in months 7 through 12, your guarantee issue window into a supplement is 63 days from the time you leave the Advantage plan. Excuse me. Can't get this catch out of my throat. So in a way, it can potentially extend your initial guarantee issue into a Medicare supplement up to 12 months. If you stay in the Advantage plan past the 12-month window, you lose your guarantee or you lose your test drive opportunity to have guarantee into a supplement. And basically you're limited to getting out of that Advantage plan during the next open enrollment period or enrollment period of some sort. The other way you can use a test drive is if you decide to enroll in a Medicare supplement when your Medicare goes into effect, and you have a Medicare supplement, whether you have it for 6 months, whether you have it for 6 years. As long as you have continuous coverage through your Medicare supplement without any breaks in coverage, and anytime in the future you decide that you want to try out a Medicare Advantage plan for any reason, you can drop your supplement and enroll in an Advantage plan during the next open enrollment window. And you would have a 12-month test drive period to try that Advantage plan out. If at any time during that 12-month test drive, you decide you do not like the Advantage plan and you want to go back to a supplement, you would be guaranteed issue back into the supplement you left. So if you use the test drive when you first get Medicare, you're guaranteed issue. If you decide to drop it within that 12 months, you're guaranteed issue into any company. If you use that test drive down the road because you've had a supplement without a break in coverage from the time you got Medicare, you're only guaranteed back into the company that you left. Hopefully that makes sense. Are there any questions about how any of that works? I know that's probably a lot to take in, and these enrollment periods can be a little confusing. I do have a question. So I do have a question. Retiring in July, already have been covered by employer coverage. I'm assuming already enrolled in Medicare Part A, but not enrolled in Part B. When do we need to be on Part B in order to sign up for Medicare Advantage programs, or can we do both at the same time? So if you have worked past age 65 in your initial enrollment into Medicare, whether again you enrolled in any part of Medicare A or not, when you retire and lose employer group coverage from active employment and you enroll in Part B, it's when you enroll in Part B that your 6 months of guarantee issue starts for supplements. You get that 3-month window for initial enrollment into a Medicare Advantage plan. If you know the date of retirement, you can coordinate all of those benefits to start at the same time, which would be the month, excuse me, the month your Medicare goes into effect. So you would want to make sure that your Medicare is going to go into effect, that you know what the effective date of that Part B benefit is. And as soon as you have that Part B effective date and a Medicare ID number, you can contact an Advantage plan or a supplement and enroll in that coverage to be effective at the same time. And then the next question is, do people have both Medigap and a supplement plan? I'm not sure what you mean. Medigaps and Medicare supplements are the same thing. If you're asking, can they have a Medigap or supplement and a Medicare Advantage plan? The answer is no. You can only have one or the other. So again, Medicare Advantage plans work differently than Medicare supplements. Your out-of-pocket costs are different. I will address that question in just a moment. My apologies, I missed it. Out-of-pocket costs with Medicare Advantage plans are different than with Medicare supplements. Again, you still have to pay your Part B premium. There may be an additional premium for the Medicare Advantage plan, although in El Paso County, for example, I can tell you there are many plans that are available that have no additional monthly premium. But regardless, you do have to pay the Part B premium. And there will be other out-of-pocket costs with Advantage plans in the form of copays, co-insurances, and/or deductibles for some services. Again, Medicare Advantage plans have to provide all services that Medicare A and B would normally cover. So they have to provide any and every service or benefit of Medicare, original A and B. The difference is that all of those services are provided and covered through the plan that you enroll in. So you don't have A and B and bills go directly to Medicare. Everything is coordinated and covered through the insurance plan. Again, most plans, especially in El Paso County, will include drug coverage. However, we will talk about plans that do not include drug coverage and what that means. With Advantage plans, typically you may be limited to seeing certain doctors or going to certain hospitals or facilities for care. Although, if you are anywhere in the country, anywhere in the United States, and you have a medical emergency, regardless of where you're at, your plan would have to cover the cost of a medical emergency. Networks do not apply in medical emergencies, but benefits and cost sharing are different than from original Medicare. And just to make things a little more complicated, there are many, many different kinds of Advantage plans. There are HMOs, PPOs, fee-for-service plans, special needs plans. All of these plans, especially plans available specifically in Colorado, are listed in the back of the Medicare and You handbook that is specific to Colorado. So Medicare and You handbooks are now state specific because they do list in the back of the books all of the individual Part D plans and all of the individual Advantage plans for each state. If you wanted a listing in the Medicare and You handbook, you would have to call 1-800-Medicare and request that book be mailed to you state specific. So you want to request the Colorado Medicare and You handbook for a complete listing. The other way you could find a listing of all the plans available in your area, specifically by zip code, would be through the Medicare website, medicare.gov, and through their plan finder, their search engine for that service. Other types of Medicare Advantage plans include Medicare savings accounts. Unfortunately, we have none available in Colorado right now. Medicare cost plans, which I'm not going to talk about a whole lot because they are being sunsetted, meaning Medicare is making them go away. We don't currently have any demonstration or pilot programs in Colorado, but we do have a PACE program of all-inclusive care for the elderly, which we will talk about a little bit. So we're going to talk about each kind of plan real quick, and hopefully this will answer your network question here. Starting with HMOs. So if you've ever had or been enrolled in an HMO, you know what I mean when I say an HMO is an HMO is an HMO. HMOs all work the same way, health maintenance organizations. When you are enrolled in an HMO, you must stay in network for services. You can only go to providers who are contracted with that HMO. You can only go to facilities contracted with that HMO. If you go to any provider or facility outside of the network of that HMO, that service will not be paid for. If you are in an HMO and you use Medicare services or providers that are not part of the HMO, Medicare will not pay for those services either. You must stay within network, within the list of providers that the insurance plan provides to you. You must go to the facilities that they contract with. And you will have a copay. With most Advantage plans, you will have a copay for every service. Again, if you are outside of the network, and for all intents and purposes, your network basically is going to be your county of residence most of the time. That is going to be your service area or your network. If you are outside of your network in a medical or urgent medical need, you are covered no matter where you're at, in or out of network, because it's an emergency. All HMOs include drug coverage, Part D. PPO plans are a little more flexible than HMOs. PPO stands for Preferred Provider Organization. In a preferred provider organization, that plan has a network of providers and facilities they would prefer you use. And if you use that network of providers and facilities, your copay, your out-of-pocket cost will be lower. But it doesn't limit you to the providers and facilities that they contract with. And you would be allowed to go out of network as long as you can find a provider that is willing to take your plan. If you go out of network and find a provider willing to take your plan, your out-of-pocket costs will be higher. But because it allows you to go out of network, no referrals are required, although you may be still required to get prior authorizations for some services. PPOs may or may not include drug coverage. If a PPO does not include a Part D benefit for drug coverage, when you enroll in a PPO that does not include drug coverage, basically what you're saying is that you have another form of drug benefit that you're using instead of Medicare's Part D. So it does not allow you to enroll in a separate drug plan if you enroll in a PPO without drug coverage. Most PPOs in this area include a drug benefit. Fee-for-service plans, or PFFS plans, were designed to be the most flexible Advantage plans, and they basically have no network. What that means is if you're enrolled in a fee-for-service plan, you can basically go to any Medicare-approved provider or facility as long as that provider or facility is willing to take your plan. So there's no network, you can go anywhere, but it becomes your responsibility to find a provider or facility willing to take your insurance. No referrals or prior authorizations required, but the plan does set the copay for services that you have to pay at the time of service. Fee-for-service plans may or may not include drug coverage. If it does not include drug coverage, you are typically allowed to purchase a separate drug plan in order to have drug coverage. The downside of fee-for-service plans is that providers, because they are not contracted, they are not part of the network, if they agree to take your coverage one day, they can decide not to take it the next. So providers and facilities can decide to accept your coverage on a case-by-case, day-by-day basis. So you're not ever necessarily guaranteed to have a provider available to you. Now, having said that, there were unfortunately a lot of these plans being sold in areas in counties where no provider was willing to take it. So Medicare has made a rule that there has to be at least one provider contracted with these plans for people to use in any county. So there will be at least one provider willing to take this coverage no matter where you live, as long as you purchase it within the county you live in. But otherwise, it becomes your responsibility to make sure that any provider you decide to go to is willing to take that coverage every time you need a service. Medicare cost plans are basically HMOs, but they're HMOs with a lot of flexibility. Medicare cost plans were initially designed for some of the most rural areas in the country. And because in the most rural areas of the country, there may not be provider available for some services, simply because it is such a rural area. If you are in a cost HMO, it does allow you to go out of network for services if that network cannot provide the type of service that you need to have. If you have to go out of network for a service because there's not one available, there's not a provider to provide that service in the county you live in, when you go out of your county for that service, you revert automatically back to original A and B of Medicare, and A and B of Medicare pays for those services out of that county. And then when you get back into the county for services, you are back into the HMO. So it allows a lot more flexibility, but it was designed again specifically for very rural areas where there may not be certain types of providers available in that area. The other difference is that typically you can join a Medicare cost plan, HMO, at any time of the year. It's not limited to the annual open enrollment. And you can leave that plan any time of the year. Again, not limited to the annual open enrollment. These plans originally did come with Part D, and then there were a couple of years where they did not include Part D. But again, these plans are being sunsetted, meaning they have become very limited. They're only available in very limited counties. And as of 2021, I believe most of them do include drug coverage if they're available in the county you reside in. However, they can be rather expensive for these kinds of plans, and eventually they are going to be phased out completely. And then PACE, again, program for all-inclusive care for the elderly. Basically, PACE is an HMO on steroids. PACE programs are HMOs, Medicare Advantage HMOs, but they're specifically designed for a very particular consumer. These plans are primarily for people who are Medicare and also Medicaid long-term care. The reason that these plans are designed specifically for that population of people who are Medicare and long-term care Medicaid is because it's designed to help people stay in the community that would otherwise probably have to go into a facility under Medicaid because they are unable to stay independent in the community. The benefit of this PACE program is that it does provide case management. It provides transportation for medical appointments. It can provide socialization. It can provide a ride to lunch at their center every day. Again, it's designed to support people who are probably living by themselves. It's designed to support people to help them remain in the community versus going into a facility. If anybody wanted more information about these kinds of plans, you're welcome to give us a call and we're happy to talk to you about them. But again, primarily for those who are Medicare and Medicaid. Those are the primary Advantage plans that are available in this area. So real quick, just to make sure I address the question about must live in the service area. So is there an out-of-network with Advantage plans that may not be encountered with straight A and B? So there is no network with original Medicare A and B. You can go to anywhere in this country and use any provider that's willing to take A and B. If you have an Advantage plan that you have a network, if it's an HMO, you have to stay in network. If it's a PPO, you can go out of network, but it's going to cost you more in out-of-pocket copays. If you have a fee for service, there is no network. You can go to any provider, but you have to be careful about making sure that your provider will accept your coverage on a case-by-case, visit-by-visit basis. So are Advantage plans better than original A and B of Medicare when it comes to that? I guess that depends on what kind of Advantage plan you get into and what kind of circumstances you are in. One of the most important services of the SHIP program, which is what we are, the SHIP program, State Health Insurance Assistance Program, is the ability to sit down with people or talk to people on a one-on-one basis about your specific situation. Everybody's situation is different, no matter how similar two people may be. Everybody's situation is different, and that is one of the benefits of talking to one of our counselors on an individual basis, is so that we can help you understand your situation and help you understand the options that might best apply to your situation, so that ultimately you are making a choice that is going to work best for you in the long run based on that situation. So I'm not really sure if that answered your question, but hopefully it will give you some guidance. And again, if you want to talk about it one-on-one, just give us a call. We're happy to talk about it and make sure that you understand your options. And let's see. So Part D is drug plan. Yes, when I say Medicare Part D, I refer to the Medicare drug benefit. D is for drug. We will talk about that next week in great detail. Most Advantage plans include Part D drug benefits already included, rolled into the ball of wax. Otherwise, you buy a standalone Part D benefit, an individual Part D plan separately. That's the other thing you need to understand about Medicare supplements versus Medicare Advantage plans. Medicare supplements do not include drug coverage of any kind. You have to buy a separate Part D plan in addition to the Medicare supplement. Most Advantage plans, that Part D benefit is included in the package. And then I will provide my contact information at the end. So that is Medicare Advantage plans in a nutshell. You do have rights under Medicare Advantage plans. They are basically the same rights you have under original Medicare. With a little more emphasis, you have the right to have access to healthcare providers and the type of providers that you need. You have the right to know how these providers are paid. You have the right to fair, efficient, and timely appeal processes, fast appeal processes in some healthcare settings. You have the right to get the healthcare services that you need. You have the right to get information about the services and your plan in easy to understand language. And of course, you have the right to have all of your personal medical information kept private. Those are basic rights. Those are minimum rights. Now, we're going to talk about some do's and don'ts of getting a Medicare Advantage plan. Again, I mentioned that when Advantage plans exploded onto the market a few years ago, there was a lot of confusion about what these plans were or how they worked. And unfortunately, that was caused by a lot of insurance agents and brokers not being fully educated about what they were trying to sell. Medicare has a lot of rules about what agents and brokers can do when it comes to marketing and selling these plans to you. These rules are specific to Medicare Advantage plan marketing and sales. So there are many things that agents and brokers cannot do when it comes to marketing and selling these plans. For example, they cannot approach you in common areas. Someone cannot just walk up to you and start talking to you about a Medicare Advantage plan. They cannot send unsolicited text or make unsolicited phone calls, although they have recently been allowed to start sending unsolicited emails as long as that email has an opt-out option. Or of course, they can send print media mail. They cannot use terms like free to describe zero premium plans or the reduction in costs. They cannot require that you provide your contact information, such as on a sign-in sheet in any event that they host. So if you're attending an educational event to learn about Medicare and it's being put on by an insurance agent or broker, they cannot make you sign in for that event and provide your contact information to attend that event. They cannot camp out. They call them campouts, but basically they cannot set up an info table or marketing table in medical providers' offices. They cannot represent the products that they sell to you. They cannot tell you that they are with Medicare or Social Security, or that they are in any form related to the government. They cannot market products at educational events, although they can do a marketing or sales event immediately following an educational presentation in the same area as the presentation. They cannot buy you lunch or dinner. They can provide light refreshments, snacks, cookies, something to drink at events. They cannot offer free gifts or free services that have a value greater than $15. And as long as that gift or service is provided free to anyone, regardless of whether or not you enroll in anything that they're selling, they absolutely cannot go door to door. They cannot get access to say a senior apartment complex and just start knocking on doors. Absolutely cannot go door to door. And that includes to put flyers on doors. What these plans must do for any marketing or education is they must have all materials that they intend to use submitted to and approved by Medicare before they can use them. They must comply with do not call registries. They must obtain permission to contact you. So even if you get a generic advertisement or a generic card in the mail that says I can tell you everything you want to know about Medicare Advantage plans. If you call the number on that card to ask questions about that information, you're giving permission to contact you. If you have contact with an agent or broker and they schedule an appointment with you, they have to complete what's called a scope of appointment. And what that means is a scope of appointment is a document that says you have an appointment with this person to talk about this product. And they have to specify what product they will talk about to you at that appointment. They are only allowed to talk about that product. If you wanted additional information about additional products that they might sell, you would have to either do another scope of appointment, and it could immediately follow the appointment you just had, or they would have to schedule a different appointment with you to talk about a different product. So these rules are pretty strict, but they are rules that you should be aware of in many cases to make sure that you are protected, and these rules are put in place for your protection. And I did include, I believe, in the email that I sent you last night, an additional handout that has some additional information about marketing Medicare Advantage plans specifically. Anytime you have any questions, concerns, or are not sure about whether or not someone's doing anything appropriately, you're always welcome to call us. We are happy to help you understand what can and cannot be done and help you determine whether or not that's happening. Okay, so let me look at another couple of questions here, see if there's any questions. I have a question, is there a gap or uncovered fees with a Medicare Advantage plan since the MA plan becomes Part A and Part B? So I think what you're asking, is there anything that the Advantage plan does not cover? With Medicare Advantage plans, you will have copays for almost every service. Typically, these kinds of plans do usually provide zero copay primary provider visits. They provide the same benefit as Medicare, zero copay preventive services. But otherwise, you will typically have some sort of out-of-pocket cost for any and every other service that you receive that would be covered by Medicare, but is under the Advantage plan. So are there uncovered costs? Not necessarily, but there are costs to you out of pocket for most every service you receive while you're enrolled in an Advantage plan. And that's usually regardless of the type of Advantage plan. So if that doesn't answer your question, please let me know. So things to think about. If this is the direction of coverage that you're looking at, there are some questions I want you to ask. Ask yourself and ask the plan before you enroll. First and foremost, if you have medications that you need to have covered, I would encourage you to make sure that if you get into an Advantage plan that includes drug coverage, make sure that plan covers your drugs. Not just that it has drug coverage, make sure it covers your drugs, meaning it covers your specific medications on its formulary list of drugs that it will pay for. Just because it has drug coverage does not mean it will cover every drug available. So make sure your specific medications are covered by asking them to look up all of your medications to make sure it's on their formulary. If you have a primary or any sort of medical provider that you want to retain, so say you have a family doctor that you've had for 20 years, make sure that that doctor takes the Advantage plans that you are looking at before you enroll in those plans. If you enroll in a plan and you don't check to make sure that any retained doctors are within that plan or part of that network, then you will no longer be able to see that doctor, most likely. Either check with the doctor to see what plans that they will take, or check with the plan to make sure that your doctors are listed in their network. If you have a hospital preference, I know in El Paso County, we have 2 primary hospital networks, and I have known people in the past who have very, very strong opinions about one network over the other. If that is the case, if it makes a difference to you, find out what hospital network the plan that you are looking at participates with. Some of them participate with both networks, some of them don't. If you doctor a lot, if you go to the doctor a lot or you see specialists, keep that in mind that many plans will require, HMOs and PPOs may require that you get referrals to see some specialists. And keep in mind that you may be required to get that referral from a primary doctor every time you need to see a specialist. So the more specialists you see, the more often you have to go to your primary doctor to get that referral, and your copays to see those specialists typically are going to be higher than they are for the primary doctor. And then any other thing that might be important to you about your medical care are the things that you need to ask the plan about before you enroll. You want to make sure that you understand the rules of a plan before you enroll in that plan so that there are no surprises down the road. I have a question here. It says, does Medicare coverage require referrals to see specialists? Or is it okay if the specialist takes Medicare and then no referral required for Medicare to cover it? Original Medicare does not require referrals or prior authorizations ever. If you want to see a specialist up in Denver for a condition and you don't like any of the specialists in Colorado Springs, all you have to do is pick up the phone and call the specialist in Denver and schedule that appointment with Original Medicare. With an Advantage plan, you need to go through that plan to make any arrangements to see specialists at all, most of the time. But if you want to see someone out of network, that's a little more complicated, but it does have to be something you go through the plan for. So no, there are no networks, there are no prior authorizations, no referrals required with Original Medicare. Again, email that I sent you last night included some handouts specific to Medicare Advantage plans. The first one is just a general handout, multiple page, just goes over the different types of plans and how they work. Just basically FYI information for referral purposes. And then the second handout is a one-pager, front to back. This is a handout that my most wonderful, awesome volunteer has put together for us. This is a handout that basically lists all the Advantage plans available in El Paso County. She also did one for Teller County, but unfortunately, those are the only two counties we have them for at this time. She has listed all the Advantage plans available, and there are quite a few this year. And El Paso County has indicated what kind of plan it is, HMO, PPO, and has done a side-by-side comparison of some of the different costs through each of these plans for basic services. So it tells you whether or not the plan has a premium, tells you whether or not it includes drug coverage, indicates what hospital network a particular plan contracts with for this year, gives you an idea of what your co-pays are for basic services such as whether or not there's a drug or a hospital or medical deductible with the plan, tells you what the co-pays are for primary visits, specialist visits, those kinds of things. A lot of work went into this. It is wonderful to have this, this at a glance kind of handout that shows you all the plans specific to this particular area and answers a lot of questions just on this one page. So I am very, very grateful that she does this for us. I think it's a very useful tool to have. And certainly it is updated every year. I hope you guys find it useful as well. Last thing I'm going to touch on just real briefly, as I did last week, and we will talk about it in more depth in week 4, is Medicare savings programs. There are financial assistance programs available for people who have limited and low income to help cover the cost of Medicare Part B, and in some cases, even more than Medicare Part B premiums. These programs are eligibility is based on income and asset levels. Income and asset levels listed are still current for 2021. Those numbers don't usually change or changed by the government until around April of each year, so these are still applicable. If anybody is interested in more information about these programs for financial assistance, you're more than welcome to give us a call. We do help with these applications. And that is it. We are done. I appreciate your patience. I know this was a lot of information to take in, but certainly I hope you found it helpful. And if there's any other questions, let's have them. Again, you can unmute yourself and ask the question, or you can type it into the chat box. Here's my contact information and the information for our office. I've provided our local phone number here in Colorado Springs and the toll-free statewide number. Depending on where you call that number from, it will route you to the SHIP office closest to you. We are available Monday through Friday from 9 to 4. We have a total of 5 full-time Medicare counselors available to talk to you at your convenience. And we're happy to talk to you one-on-one about any questions or concerns you may have. If anybody did not get the email with the handouts and the slides that I sent last night, please feel free to send me your name and email address, and I will be happy to try and send that to you again. And I'm not hearing any questions. You sure there's no more questions? Again, I'm happy to answer questions. Just shoot me an email at any time, and I'm happy to answer any questions down the road. We also help people during open enrollment periods to review their options every year. I appreciate the thanks. I hope everybody found today helpful. Hopefully I will see most of you next week when we talk about Medicare drug coverage in depth. More than you ever wanted to know about drug coverage, I'm sure. All right. Well,
Thank you.
You're very welcome. Thank you. And don't forget, you will get an email probably sometime tomorrow that includes a link to a recording of this presentation that will be good, I believe, for at least a week. And you may also get a survey. We do appreciate any feedback you provide to us through this survey about our presentations. It helps us improve our services and our presentations, and it helps determine what we talk about. So if there's any other subjects you want to hear about, we're happy to hear about that from you. Otherwise, if there's no other questions, I'll let you all go and enjoy the rest of your evening. Thanks again for coming, and we appreciate your attendance, and hopefully I will see you next week.